Faryal Hajee is, as you know, they are husband and wife, and she just had a baby. May Allah bless her. That's a beautiful child. You can see the grandma. And my impression when they come back, they tell me, well, this is a teenage kid you sent me to. So we often have to explain how she's a mother of two. Or two
Three.
or one? Three, mashallah. So.
Okay, so I'm going to just talk. Mine's actually fairly less complicated than Muhammad's, but Assalamu alaikum everyone. So
sorry, what did you say yours?
so mine's very. I just touched briefly, really on
Would you mind
general
introducing your
allergies.
education first, so that people?
Oh, I apologize. Okay, so I grew up in England. I did my A levels in England, and then moved to New Jersey in '96, and did my undergraduate in Hoboken, New Jersey, at Stevens, and then after that went to medical school with Muhammad at Ross, and then did my residency and fellowship training at SUNY downstate in Brooklyn also, and I have a solo practice in Lincroft, and been there for it's about two and a half years now. So that's pretty much it. So just to touch, we have spring coming up. So those of you who suffer from allergies, you know what I'm talking about. Probably preparing for the next few months. Those of you who don't, you can just enjoy the talk and probably doze off at some point. Really today I wanted to discuss about just general seasonal allergies or perennial allergies, which is year-round allergies. Some people have seasonal allergies that are just focused on spring, summer, and fall, so that's really pollen. And others who are less fortunate have allergies all year round, and that we called perennial. And those are really secondary to indoor allergens mostly. So things like dust mites, cockroaches, if you have animals in the house, pets, guinea pigs, cats, dogs. Obviously, you shouldn't have dogs, but a lot of my patients do. Really the mainstay here is what I do, and if you do suffer from these allergies, you really should find out what your allergies are. And so the way that we can identify allergies is by doing skin testing in the office. And so it's a very easy procedure. There's no blood drawing. It's really a superficial needle, and all we do is we touch the skin or scratch the skin with the allergens. So it's a liquid form, and we put the different types of allergens and ragweed, pollens, and dogs, cats, different things like that. And we put it on the skin. We wait 20 minutes, and in 20 minutes we can see which one bubbles up. So it looks like a hive. And we can tell you pretty much at that point what you're allergic to. And based on those tests, then we can help you identify what your triggers are, so what causes the allergies. So for example, if you're allergic to, the easy one is if you're allergic to your cat, you really have to get rid of the cat then. That's pretty easy, right? It's in your environment, you can remove it, the allergy should be gone and you're okay. It's more complicated when it's something that you can't remove from the house. Okay. So briefly, these are the topics I'm going to be talking about, the ones in red. I don't know if you can see very well. So we're talking about allergic rhinitis, which we've started already, and then I'm going to briefly talk about asthma. But these are some other conditions that we can discuss at some other point. Food allergies, skin allergies like eczema, bee sting allergies, which we suffer from a lot in New Jersey, and of course drug allergy. So just quickly, so I'm going to back up a little bit. We'll talk about what an allergy is actually. We're going to be talking, like I said, about allergic rhinitis or hay fever and asthma. What is an allergy? It's the body's immune system overreacting to an allergen or to an otherwise non-harmful substance. So pollen is not harmful, dust mites are not harmful, but if you're allergic to it, then your body is going to overreact to it, and it's harmful to you. It's not harmful to everybody else, though. So this leads to a cascade of events, and will cause a lot of a chain reaction in the immune system, which results in release of substances or harmful chemicals like histamine and leukotrienes that will cause swelling, local swelling, and inflammation, and even mucus production in the area that it's the allergen is exposed to. So if you're breathing it in your eyes, your nose, your lungs. So there's two types of allergic rhinitis, which is basically just the nasal congestion, right? The regular allergies. The seasonal, which we sometimes refer to as hay fever, or the year-round, which was coined perennial. And the symptoms of allergic rhinitis is here: sneezing, stuffy nose, runny nose, a lot of congestion, itchy eyes, or nose, and even itchy mouth and ears as well. So, how do allergies make us sneeze and wheeze? So, you can see the pollen in the environment goes up in your nose and your eyes. And if you're an allergic individual, now this is only if you're an allergic person. If you're not an allergic person, this doesn't happen to you. But so the body produces the antibodies. So this is the pollen right here. Pollen in the environment goes up into your eyes or your nose, and these are the antibodies, your IgE antibodies. That if you're an allergic person, you'll have a lot of. For some reason, your body will produce too much of these IgE antibodies. And when the antibody meets the allergen or meets the pollen, it will go in and attach to this allergy cell, the mast cell. And when you have lots of allergen on these antibodies, they will cause a reaction here that will result in inflammation or inflammatory mediators being released. And all these are the chemicals, so histamine and leukotrienes, prostaglandins, all of these things will come out. The allergy cell will burst open, and the histamine and all these other chemicals will come out of the cell and go into all the tissues surrounding the cells. So seasonal, we touched on already. Spring, summer, fall. Pollens in spring are trees. Tree pollen. In the summer it's grass pollen, and in the fall we're talking about weed pollen. And of course there's outdoor pollen, which is mold, which is sometimes in May, and also in the winter we can get mold as well. Perennial allergic rhinitis, this is the year-round type, and this is the main ones we talked about, but that's a picture of a dust mite, which is microscopic, so you cannot see it. They don't bite you. They're not, because sometimes when I tell the patient that you have an allergy to dust mite, they look at me that I'm trying to tell them that they're dirty. It's not a hygiene issue. Everybody has it. It's ubiquitous, means it's everywhere. It's in my bed, your bed, everybody's bed. And they are microscopic. They are the same family as the hair lice, but they are so tiny that even under a microscope, it is very difficult to see, even under a microscope, under high magnification. In fact, they put sometimes fish food in so you can see it, because you see the fish food moving, then you can kind of identify that there's a dust mite there, but they're very tiny. And they, like I said, they don't bite. But when you're sleeping at night, they live in the bedding, and they live in the pillows and the mattress. And when you're sleeping at night, which is at least 6 to 8 hours, right, all of us? So the majority of our night is in the bed. So when we're sleeping, they go up in your nose and your eyes. I mean, they don't go up, but we're inhaling them. And if you have an allergy to them, if you have an allergy to them, then they cause harm. If you're not allergic to them, there's no problem. But if you have an allergy to them, they're going to cause the same reaction that I showed you previously. This is what's going to happen in the level of the eyes, in the nose, in the airway even. These dust mites have been shown to actually directly cause asthma. So if you have an allergy to dust mites, then you need to look into getting dust mite covers. You need to change, you have to have dust mite covers for the mattress and for the pillows also. And also if your mattress is 10 years old this is the time to go and buy a new mattress, okay? Because at 10 years, the statistics are of 10 years, if you're at 10 years, 60% of your mattress weight is dust mite. It's quite disgusting. So even if you're not allergic, you should just make sure you check. So this is the skin testing. Very easy, minimally painful, really very well tolerated. I guess more uncomfortable is not the skin test itself. Is after I put the allergen on, then you can go crazy itching. But the test itself is very easy. No problem. So treatment nowadays, almost all the antihistamines are over the counter. So if you have regular allergies and you're a little bit itchy, go buy some Benadryl, go buy Allegra. You don't have to come and see an allergist for that. But if it's ongoing and you're taking your Claritin or Benadryl every day, most days of the year, then I think it's probably a good thing to go see an allergist or at least your doctor. There's nowadays lots of nose sprays that you can use which are steroids. So if you have glaucoma or something, you know, this again, these are prescriptions, so your doctor's going to direct you. But if you have glaucoma, the nose sprays are not necessarily the right medication for you. This is why these are still under prescription. And then, of course, there are something called allergy injections, which I'm currently on myself because I suffer from asthma. And what this is a natural way of building your immune response. And what you're doing is you're injecting the allergen into your system. It's a vaccine. You're getting a vaccine. So if you have, Dr. Fruki gives pneumovax, for example, when you're 60-something years old, you have to go get your pneumonia vaccine. So what he does is he gives you the vaccine. You go home, and in 4 to 6 weeks, your body produces IgG against that bacteria. And now, if your body gets introduced to the pneumonia bacteria, your body will already recognize it as a foreign particle. It will remember that, oh, I don't like this particle, but I know how to attack it. So when it meets this bacteria, it will already attack it. So it should not be a problem. You will not develop severe pneumonia with with the vaccine. Unlike Dr. Faruqi's type of vaccination, this is different because you're allergic to these things. So I cannot give you the vaccine for dust mite, because if I do that and you're allergic to dust mite, you will have an anaphylactic or a severe allergic reaction. So the way that we can do it is every week you would come in the office once a week and you would get a vaccine, but the vaccine has to be so dilute initially that your body doesn't even realize that it's getting a vaccine in its system. And every week you would come, we would desensitize you. So you're getting every week a little bit more vaccine, a little bit more vaccine, a little bit more vaccine, until in 6 months, you'll be on a very large dose that you wouldn't have tolerated in the beginning. But now your body didn't even realize it was getting it, and it's actually already produced IgG to dust mite. And your IgE for dust mite will drop. So the bad antibody will go down, the good antibody that we want, IgG, will go up. And so now when you see dust mite in the future, the body says, okay, I know what this is, takes care of it, and you're done, and you don't have the allergic response that you normally deal with otherwise. So it's not for everybody, though. It's a great thing, but you can see it's a huge commitment, because that means you have to come to the office once a week for the next 4 to 6 months, every week. And then once you're on the large dose, at that point, then you would come once a month so that your body can develop a memory to it. So every month for the next 3 to 5 years, you get a shot. So it's not something for everybody, but it's a good alternative for people that the medications don't work on, or they have side effects from the medication, or they have glaucoma or something where they cannot tolerate the medication. Allergy injections are really good for those people. So quickly, asthma. So asthma, what is asthma? It's a chronic airway disease. Now understand, it's not a lung disease, it's an airway disease. So what that means is an X-ray is not going to be helpful. So lots of people, if you have coughing or your child is coughing and they do an X-ray, it doesn't mean that the asthma is ruled out. It means that the lung is okay. There's no pneumonia in the lung, or there's no disease in the lung, but it's not an evaluation of the airway. So asthma is the airways are the tubes from the mouth to the lungs. So what you're doing, in a sense, is when the airway is responsible for air, right? For air going in and out, for oxygen to get in, carbon monoxide to come out. If there's a problem in the airway, if there is narrowing or inflammation of the airway that should be like this is going to constrict and be like this. So now you have to have high pressure, or air going, or oxygen going through a high pressure cannula here. So when you have this issue, then you're going to have symptoms of asthma. And so this is a nice picture. So, so you're breathing in through your mouth, your nose. The air goes in nicely. This is a normal airway or tube that it should look like this. So nice and open. See this? Looks nice and clean. The air goes in and out. It delivers oxygen to the lungs. Carbon monoxide is produced, goes back out. Now, this is an asthmatic. So what happens in an asthmatic is if you have allergies or you have even bronchial asthma, I'll talk about why you get asthma, but this is a picture of an asthmatic airway. Okay, so what's happening here is you've got inflammation and you get thickening of the muscle here. This is this is how it should look. This is thickening of the muscle around the airway. And this is all mucus production from all the inflammatory cells that we talked about earlier that are causing this. And also, in addition to all of this, you can get constriction, we call it bronchoconstriction, which means the airway is spasming. It can become small. And so when that happens, you can develop wheezing, and you hear that sometimes. It's like a whistling of the lung. If you put your ear on the back of, you don't need a stethoscope, you put an ear back of your child or of somebody who's wheezing, you can hear a whistle. This is the turbulence of the airway, of the airflow going through the airway. So the symptoms can be wheezing, but sometimes it's not wheezing at all. That's what everybody thinks, it's wheezing, right? But you don't have to have wheezing, you can just have coughing. So if you have a chronic cough for years or months, don't know what it's from, this can also be a sign of asthma. Okay, so coughing is one, tightness of the chest, shortness of breath, so it overlaps with heart problems, so it might not be asthma, it might be something from the heart, but often patients are always nervous about the heart first, so they'll go get it checked out, they'll get a stress test, everything's normal, but they still have, when they're running around or they're going up the stairs, they have a tightness, so then maybe this is asthma, maybe this is not heart disease. Okay? So the triggers, so there's two types of asthma. Most asthma is from allergies, so 56% is from allergies. That means a whole lot is not from allergies, so you might not have any allergies, the skin test is going to be completely negative, but you still have asthma. So the importance here is that you have to find out the triggers. So skin testing is nice because you can figure out the triggers. If you're an allergic person, your triggers are going to be allergies. If you're a non-allergic person and you have what we call bronchial asthma, your triggers are going to be non-allergy. So your triggers might be smoking or exercise, right? Or infections. If you get a cold, that will be your trigger. Okay. So bronchial asthma, viral or bacterial illnesses such as the flu can cause it. Exercise can also cause it. So what's the treatment? Very easy. There's two major ways of treating. The first one that you want to do is do a quick relief medication, such as the pump. You see, you've probably kind of seen it, or at least somebody, you know somebody that has one. Quick, it's a short-acting beta agonist, like albuterol. You take a couple pumps. Sometimes they have it in a liquid form. You put it in the machine and you use it. It makes you feel better in a few minutes. But you cannot use that for a long time. This is good for once in a while. You have an asthma attack, you need it. You cannot use this on a daily basis. So if you're using this more than 2 times a week, the recommendations, if you have to use this more than 2 times a week, or you have nighttime awakenings more than 2 times in 1 month, this is an indication that your asthma is not well controlled, so you need to go see the doctor. And at that point, they will put you on a long-term controller or a medication that you have to take every day. Doesn't mean it's lifelong. You don't have to take it for the rest of your life. But for that period of time, you have to take a medication every single day to get the inflammation down, and then at that point, you can stop the medication. But for that period of time, you must be on something to help control the inflammation that's going on. Okay? So again, diagnosis, we do a skin test to see if you have allergies. But we also do a pulmonary function test, which is basically a fancy way of saying a lung test or airway test. And we make you breathe in the office, and I make you blow out some candles, and we look on a fancy computer and see how your airways look. Now keep in mind, asthma can look like we used to say it's reversible. It's not fully reversible, but for ease's sake, let's say it's reversible. So if you are not having symptoms at that minute, your airway may look like completely normal. if you're coughing and you're wheezing, and then I did it at that time, now at that point I might be able to see, okay, now this is what's going on here. But if you have a normal pulmonary function test, does not mean that it rules out asthma, but this is something that you should know. Okay? So that's really it. I just want to conclude my talk with spring allergy tips, and spring is upon us. So some tips without seeing a doctor. So do a thorough spring cleaning. I would start that maybe the next few weeks. So what I mean by that is get all the filters of your air conditioners out, get them cleaned. If they check with your manufacturer, they have the paper that comes with the brochure that comes with your air conditioning and all your vents. Make sure, if they say some of them make you change it every 6 months, some machines once a year. Okay, so check what your the manufacturer's recommendation are. Get those cleaned up. If you've had old books and things like that, areas where you can clean up the dust, this is the time to do it. Okay, minimize outdoor activity when pollen counts are high. You can go on Google and look up pollen counts in the area. Okay, so you want to check the New Jersey. I think the closest station here is Springfield. They have, of course, in Manhattan as well. They used to have one in Newark, but they don't use that anymore. So you check the pollen counts. If you are an allergic person who is allergic to pollen, specifically, you can check it on a daily or a weekly basis. So if the pollen counts are high that day, then you may not want to go out. That's a big statement there. But the other way you can do it is if you're going to go out and you have pollen allergy, specifically tree allergy, the best time to go out will be before 10 a.m., okay, or after 4 p.m. because the pollen counts in this area are typically high between 10 a.m. and 4 p.m. So if you're doing parks or you're going for exercises, early in the morning or after 4 o'clock, okay? If you're going to take medications, or if you're going to go out on a time where it's between this time you have a barbecue coming up, or you're going to the park, and you know that you suffer from allergies, then you can take medications on these 30 minutes prior to outdoor activity. So if you want to take your antihistamine, if you have asthma and you know your asthma is going to act up, you can even use your albuterol before you go out. So this way, when you're there, you enjoy, you don't have to be coughing and wheezing. On a daily basis, your house, you try to eliminate the pollen counts in your house. So keep the windows shut, okay? Don't keep them open, keep them shut. Use the air conditioner if you need, or use a fan. It's very important that you do this so that at least your house is clean of pollen, okay?
Yeah, that's great, that's great. Thank you so much.
Okay, now if you have a cat or animal, cats are okay because they don't go out as much, but if you do have an animal that goes out and you bring them in, you want to clean off their dander because the pollen will attach to the dander, so you'll be bringing pollen in that way. You can get like a baby wipe or something and wipe them down. So all same thing that goes in the car. You know, when you're in the car, keep the windows closed, use the AC if you need to, and the vents. Keep the vents away from your face because once they collect, they are bringing air, outside air in, you're going to have pollen coming in your face. Okay, so move the vents away. And if you're mowing the lawn, wear a mask. You can get that from CVS. And they're reusable and very cheap, so you can do that. And I think that's pretty much. That's pretty much it.
Thank you. I have a question. Number one is, can allergy cause any cancerous or precancerous condition, and can a person manifest with the allergy symptom? And the second question is, asthma, although is an inflammatory condition, the cough you mentioned, that just elaborate a little bit about that. It is a symptom and which is a marker for a process other than a disease itself.
Right. Yeah, so the first question, can allergies present as a precancerous condition? Not typically. I mean, it's very rare conditions where it could, but typically allergies are allergies. I mean, they're fairly straightforward. I mean, most of the time, you go into a house, you have a cat, you get red, your eyes are red, itching, sneezing, and that day or the next day even, you might wake up and you need a Benadryl, you're itchy, you may have a rash. So it's nice. In that regard, it's nice. Sometimes they're not as obvious because they might be a house that has a lot of dust. You don't see the dust, but you feel something, and the next day you have a reaction. So in that way, it's nice and it's more straightforward. So on the most part, no. I mean, if allergic reactions typically are not precancerous, there is a very rare condition, systemic mastocytosis and other forms that I don't want to talk to you too much about because they're so rare and they're not even something to worry about. But if you're currently getting allergic reactions, I will say this, if you're getting repeated allergic reactions for unknown causes, then you need to get checked out and do blood testing and things like that to see what's going on, because there are other conditions that are not really cancerous, but that are other conditions where you have a protein lacking in your body that can result in repeated allergic reactions for no apparent reason. So you might have swelling of the eyes, the mouth, those types of things that are not directly related to food or an animal. And then the second question you had was the coughing. Yes, so coughing is not a disease, but it's a manifestation of something, another process going on. The coughing itself can be a whole talk in itself, because there's so much that can cause coughing. One being an asthma or allergies. You don't have to have asthma to have cough. You can have even reflux, even if it's silent, even if you don't realize that you have heartburn or reflux disease, that can actually cause a cough, because the acid is spilling over near the airway and the esophagus, and it's irritating the area, so you cough as a result. Other causes of cough can be a postnasal, so it may not be asthma, but it might be upper airways that you're dripping in the back. We call postnasal drip. I don't know if any of you have that. That can also result in a cough as well.
And often a question is asked to me, people who have eczema or contact dermatitis or allergies, they are not infectious.
No, and asthma is not infectious either. So, you know, that's my biggest thing. And often I have to write notes to the school to say that the kid is not sick, but has allergies, has asthma. And so please allow the child to go back to school, but the kids around them, or even in the waiting room, people will move their kids away because they think that the child is sick, but it's not, it's asthma. And this is one of the reasons we have to protect it, because regardless of whether it's asthma or not, if you're coughing, you're spreading germs, right? So, I mean, you have to be respectful. Eczema is the same thing. Some eczema can look pretty horrific, and it can look infectious. And although eczema itself is not infectious, you can develop bacterial infections in the skin way more than the general population. And as a result, this can be, you know, you can be a host for MRSA, which has got a lot of media attention recently. So, but otherwise, no, it's not. Normally, it's not infectious.
And poison ivy, ochre, sumac, that's often asked, that is it infectious?
Yes, because in poison ivy, if you have an open or bullous lesion, and all of you, if you should probably go and Google what poison ivy looks like, because this is now the time of year that you will see it. But poison ivy, if you are in touch, now not just because it's poison ivy, you might touch poison ivy, but if you don't have an allergic precursor to it, you're not going to have any reaction. So you can touch poison ivy and not have a problem. But if you are allergic to poison ivy, which a good amount of population is, then you're going to develop like pustular type lesions. And while they have pustules, those can be infectious. So if you have an allergy to poison ivy and your spouse has some and you touch it, you can also spread it to yourself, and then you can spread it to the rest of your body. So yes, poison ivy. So you can Google that today maybe.
You just said exercise is also one of the trigger for asthma, right?
Sure, yes.
So how should we know which exercise may trigger that asthma, and how what are the precautions? So we should not do that exercise.
That's an easy way out. No, if you are running, see, this is a very tricky question I get. It's a good question, because a lot of people say to me, I try to run on the treadmill, but it's not good for me, so I stop doing it. And the reason why they say is because they get some chest tightness and things. And it's difficult, because when you start running, all right, when you start running and you were completely, you know, you were a couch potato before, and now you start running, probably it's going to hurt a little bit, okay? So there's a fine line between asthma, or exercising, we call it exercise-induced asthma, versus, you know, being out of shape, okay? So if you're out of shape, you can get out of breath quickly, and it's more difficult to keep up. But if it hurts, or it burns, or you develop coughing while you're running, or even you get off the treadmill and you feel like you're going to pass out, those are not normal. Okay, so in that particular case, then you should see your doctor. It doesn't have to be the allergist, it should be a doctor, but you should run. So there's no reason for you not to run. If you have a broken leg or something, okay, but otherwise, if it hurts you and it's not, then you should go check it out, because you should be running. And especially our community, we don't talk much about exercise. We don't have that in our culture that much. And maybe if you play cricket or something, but even then, I mean, we don't have something like soccer where we're constantly running, you know? So you should run, and if it's uncomfortable or it hurts, then you go see your doctor to check. But there's very easy, because if you do have this symptom and you have this tightness, it's very simple, because you can use the albuterol medication before running. And the recommendation for exercise-induced asthma is you pump 15 minutes before you start running, 2 puffs, and then you can run, and you'll find that you can run a whole lot more, and it's now comfortable and it doesn't hurt. I mean, you might still have to stop a little bit, but it won't, that pain that is associated, or burning, it's very difficult because everyone has a different conception of this symptom, but the coughing or whatever, this should not happen when you're running. And then you can go to your full activity and become, fit. But if you don't deal with this at the beginning, then you never get to the point where you can actually run or exercise.
Well, with regards to exercise causing shortness of breath or wheezing or chest tightness, that should not be disregarded. Most often it's a coronary problem, running too loud heart as a problem. And as you may have watched the show about Bill Clinton, he used to jog for 3 miles, and when he had his angina, he could not jog any further. He was just out of breath. And this is one of the very important things, especially people in our culture. We sit for hours, and when we start getting motivated and start running, we end up with a heart attack and without realizing. As you were earlier told, that we have the smaller coronaries. We are genetically different than the other races and other people. So Asian particularly have a highest rate of heart attack, and male in Asia, and we have a higher problem. So we need to be very, very careful. Make sure you get your stress test regularly done. And most commonly in my practice, I'm seeing people with the Asian background having a right coronary blocked, and that's not a dominant artery. So it's one thing we need to watch out.
Right. And I would say if you're 20 years old and things, most likely you're okay. You can, but if you're, I would say the cutoff here at this in our community is probably on the early side. But I would say even at 40 years old, if you're having chest pain or any kind of discomfort when you're running, even if it's going up and down the stairs, you could probably just stop it if you sit down, whether it's asthma or cardiovascular. Most of the time, if you sit down, you take some water, rest, those symptoms will go away. But you don't. What I find a lot is a lot of people just don't do it then. Instead of going to see medical care, to the physician, they'll just stop doing that activity, and they'll just say, okay, this one is not good for me, I won't do it. But in actuality, if you pick it up at that level, even at 40 years old, and you identify that being a problem at that point, and you get screened, a lot of the time you can prevent anything from further, because it's either going to be cardiovascular, in which case you maybe have high blood pressure, or something that can easily fix with a medication, or diet changes, or it's asthma, and that's also very easily fixed. But if these go undiagnosed and you don't take care of it at that level, then most of the time those are the same patients that 5 years later or so they will develop heart attacks, and they probably had hypertension or high blood pressure at least 3 years or so prior to that. So this is important that you listen to your body. These are warning signs that you should understand.
Any other questions?
So, like spring season is coming, right? So
Yeah.
I notice, like during that season, if you go out, as you mentioned, 10 to 4, and you get impacted,
Yeah.
and sometimes the impact is so severe, the other medicines like Claritin or Allegra may not work.
Right.
So it takes like, a few days or weeks, couple of weeks to get back to normal.
Mm-hmm.
So is there any other remedy? I mean, I see these off-the-counter Claritin, they don't just work.
Yeah, I mean, there are several agents that you can use. There is I'm just going to address this, even though I don't like to talk about it much. But there's something called Afrin nose spray, and it's over the counter, and it's a great thing because you can, if you're completely impacted, and it opens you up, right? It opens you up right away, and it works for a few hours, and then you get closed up again, okay? Then what you're going to do is you're going to go in your bag and you're going to get the Afrin again, and then you're going to use it again because it opens you up and you feel so good when it opens you up. It's like, I can smell now, right? This is the effect of this. So this medication is very addictive because what happens, it has a rebound effect that causes more fluid and more swelling to occur, so you close up. But what I would say is if you're having this symptom and you really like you have a meeting or a speech or even you just want to get to sleep at night, you can use the Afrin that will open you up. It's like a decongestant. But you have to use it sparingly. You have to realize it has an addictive property to it. So you have, if you're smart, you can use it. It's a great medication, but you know, the problem is a lot of patients will not realize this is a side effect, and they will continue to use it, and it will make them worse. So if you need something to open you up right away, that's one option. The other thing you can use is a decongestant, but you really, you know, you have to go. It's over the counter, but you nowadays you have to go to the pharmacist, and they keep it in the back now, and you have to, I think, show your driver's license or something, because these are decongestants, so they have some side effects to them. But you can only take them, you know, taking them sporadically is okay. You don't want to take them long term. And if you have a condition like high blood pressure or any kind of cardiovascular heart problem, you shouldn't be taking those without a physician guiding you. So, you know, but that's something else. It's a decongestant. It's like Claritin D or Allegra D. Those ones, those can also help open you up as well. And the other thing that, don't forget, you can use nasal saline as well. So the one thing I can, tip I can give you is, if you do suffer from allergies and spring is your thing, you need to start the medication early. And if the medication's not working, then you go see your doctor early, because if you start early, a lot of the time your season won't be too bad. It may be a drawn out season this particular year, because we're already seeing budding. Pollen counts have not yet risen, but I would imagine in the next couple of weeks we're going to start seeing low pollen counts, and this is an unusual time of year to see them so early. So pollen and mold will be up soon, okay? So if the symptoms are not working early at this point in the next few weeks, then at that point I would see a doctor, because then you can start the medications by prescription. If you start them early, the rest of the season will go well. But if you start them midway, chances are you're going to need the steroids and things like that, which are, you know, not something you want to use. But if you have to use them, you have the option. There are things out there, in other words.
So it's going to take us time, right?
Yeah, I mean, but it shouldn't take a whole lot. I mean, really, if you take it, even if it's a week before, when you start getting the symptoms, if you start taking it on a daily basis, you should start feeling better. Again, if it's so severe and it's not, then you have to go see your doctor. But either way, if you're a person that suffers from bad allergies, you should go. This is the time to go see your doctor before the season really gets away, because the nose sprays, the Nasonex, Viramis, those type of things, if you're going to do those, you want to start those early, because then that's going to help you through the season. If you start them midway and you already have bad symptoms, those medications take too long to really kick in, that by the time you're suffering, and now that we're going to have to give you some steroids or something to get you better, you know? Yeah.
Just a point, because when we get over-the-counter antihistamines, men's age 40 and above have the prostatitis is only men's issue, and they cannot urinate, and they often get into emergencies, so be careful when you have the doctor should specify. Antihistamine and decongestant can cause urine retention and can turn into an emergency, so people should be careful with using antihistamine over the counter.
Right.
So if you have asthma and you don't have the pump, is there a quick way to kind of resolve that?
You know, no. I mean, you know, most of the time most people get away with it. Most of the time when patients do come to me, they say they just sit down and they take it easy. Eventually will get better. If it continues to accelerate, they don't have a choice. They have to go to the emergency room, or they go to a doctor's office and they'll walk in or something, and they'll give them treatment. If you don't have your pump, I mean, you know, that's a dangerous situation. You're going to have to go to the emergency room. You know, and Benadryl, Claritin, you cannot take those in place of a pump. They don't do. Unfortunately, although they help with allergies, and even if you have allergic asthma, they're not going to help with they don't have any improvement with the asthma. And even, you know, there's really nothing else. So you have to make sure. This is the time, if you do have allergies, again, if you remember you had coughing the last couple of years around May or whatever, this is the time you make sure you check your medications, check the expiration dates, make sure that you have medication in there, because your chances are you will need them. Even if it's just for a couple of weeks, but you will need them.
Just to add on to this, I have a very frequently asked question as an internist. I advise people always carry your pump with you, because often young people think they can fight it, they can resist it. Once the asthma is a process, it's a cascade of inflammatory process. Once it starts, you cannot stop it by taking anything unless you get the emergency rescue inhaler. There's 2 pumps. So those people, and kids particularly, and we see young people being reported as dying more because they think they can fight and they're invincible. This is a very common problem with young people. So they often forget to carry. So if you have an asthma, make sure you have it in your pocketbook or somewhere. Inhaler, when you go out, people often go for camping and we hear them they're in the emergency room and they cannot find the way to get there because it's too far. So asthma can be very rapidly life-threatening condition. So whoever has asthma should have his pump regularly checked. As you mentioned, we should make sure they're not expired. That's very important. Thank you very much.
Thank you very much.
And I would like to thank Dr. Sahibzada Akhtar. He is father of Dr. Faryal, and he is a retired physician. He was born in Bangalore, became doctor in Pakistan, went to England and raised his family there. Now they are him and his wife. They are living here, alhamdulillah. We want to really thank you on behalf of our entire community which is absent and on the ICOB which is present. So may Allah accept your efforts and kindness for coming here and giving us some information. We have a few medical students here who are budding doctors. They showed up and we are like so good and let's give them success. And thank you very much for joining us. Inshallah, we'll keep you posted with the next lecture.
Thank you.
Thank you.
Thank you very much.
So-